Ladies and gentlemen, Assalamu alaikum. I would like to initially thank the organizing authority of BICC to give me the opportunity to present my research work. Today's my title is Genetic Susceptibility to Lung Cancer, the role of ERCC on gene polymorphisms. Actually, ERCC on, what is ERCC on gene? It's a tumor gene repairing gene. Actually, DNA repairing gene. If in some cases DNA is damaged with different events like radiation, with the exposure of different chemicals and age effects, then it is repaired. And in repairing, there are some genes, some enzymes involved. And ERCC1 is this type of gene. So, if this type of gene is mutated, then there becomes many problems in different cancers. So, lung cancer is one of the major targets. And the objective of our study was to investigate the relationship between the ERCC1 gene and the susceptibility to lung cancer, focusing on it as a genetic biomarker or potential risk factor. This is the prevalence of cancer in globally. I have taken the data from the GloboCan and prevalence in Bangladesh. Actually, this is the official data, but in actual, the frequency is very high than the officially declared data. Actually, in our case, this is a case control study. Initially, it was a pilot study where we have recruited 60 patients and 60 control. And then we have elaborated this study to 300 patients as well as age max 300 healthy controls. Actually, healthy controls with the habit of smoking. Now, this is genetic polymorphism. You know very well what is genetic polymorphism. Any kinds of change in the DNA sequence, single nucleotide polymorphisms, or it may be insertion or deletion. In some cases, it may be the copy number variants. This is the all about the methodology. Actually, we have due to cost effectiveness, we have used the RFLP, restriction fragment length polymorphism method, which is cheap and cost effective, and then the other sequencing method. This is the primer PCR parameters, PCR conditions. This is all about the methodologies. I am not going to elaborate the methodological part. This is the socio-economic conditions between the controls, actually control smokers with the lung cancer patients. This is their occupations, their nutritional status, their habit of smoking, and different other variables with their food habit. There are different kinds of clinical findings. Overall, the summary data, and this is the main data. Actually, it's a part of our study. We have recruited 300 patients, and we have gone for different studies with the etiology, different genes with the involved in their etiological part, and in some cases, platinum-based chemotherapy response as well as their toxicities. But this is the other part of the study, and now we are focusing on the etiology and the role of ERCC on gene, and this slide shows our main results. And the TT versus CC genotype, which is very significant. The patient carrying the TT genotype is significantly associated with the risk of lung cancer in dominant model. This is also patient carrying any kinds of T variant. Normally, C is the wild type variant. Now, when it is converted to T, in the dominant model, we found that any kinds of T carrier is 1.65 times higher carrying risk than the normal C types. And the p-value also shows highly significant. And CT versus CC, it is not significant. So now finally, conclusion, the ERCC1 gene polymorphism, a specific polymorphism in 118 position where C is converted to T and the TT genotype is significantly linked to the increased lung cancer risk. So it can be declared as biomarker or genetic marker. And these results highlight the genetic variations as the potential biomarker for assessing lung cancer susceptibility. Actually, non-small cell lung cancer, most of the patients in our study, we have recruited non-small cell lung cancer. So we could guide early detection, and we can take in as preventive measures. Thank you all. Thank you for your patience hearing.
Thank you, Professor Islam.